Everyone, I am Dr. Gayatri. Today we are going to focus on upper limb bone humerus. Let's take a glance over upper limb bones such as clavicle, scapula, humerus, radius, ulna, carpus, metacarpus, and phalanges. The humerus is a long bone which has upper end, shaft, and lower end. Now let's study about the humerus. First, we will discuss about the upper end. The upper end is directed medially backward and upward. It articulates with the glenoid cavity of scapula. This is the glenoid cavity of scapula and it forms the shoulder joint. The head forms one third of spear as head is larger than the glenoid cavity. Now, the line separating the head from the upper end is known as anatomical neck, whereas the upper ends separate from shaft by a line or neck known as surgical neck, and just 0.5 centimeter above the surgical neck there is morphological neck. Then here is the greater tubercle and this is the lesser tubercle. The greater tubercle is an elevation that forms the lateral part of upper end and the posterior surface marked by three impressions, that is upper, middle and lower. Then there is a groove in between the greater tubercle and lesser tubercle which is known as intertubercular sulcus or bicipital groove. This intertubercular sulcus has the lateral lip and here is the medial lip. So in this picture we have seen anatomical neck which separate the head from rest of the upper end, then the surgical neck which separate the upper end from the shaft, and morphological neck which is just 0.5 centimeter above the surgical neck, which forms the or shows the position of epiphyseal line. Then now let's study about the shaft. The shaft is rounded in the upper half and triangular in the lower half. It has three borders and three surfaces. Let's first study about the border. The upper first part we will see is anterior border. On the upper surface, the anterior margin, the anterior border forms the lateral lip of intertubercular sulcus. As we studied, this is intertubercular sulcus. Here is the lateral lip, here is a medial lip. So anterior border forms the lateral lip of intertubercular sulcus. On the medial part, it forms the anterior margin of the deltoid tuberosity, and on the lower half it is smooth and rounded. Now the lateral border. The lateral border is prominent only on the lower part or lower half. On the lower end, the lateral border form a ridge, sharp ridge known as lateral supracondylar ridge. In the middle part, it is interrupted by the radial groove. Now the medial border. This is the medial border. Upper part form the medial lip. It starts from here. This is the medial lip of intertubercular sulcus and which continues below at the lower end and forming the lateral supracondylar ridge. This is lateral supracondylar ridge. Now there are mainly three surfaces. This is an anterolateral surface, anteromedial surface and posterior surface. The anteromedial surface, it lies between the anterior border and the medial border. It upper one third narrow and forms the floor of intertubercular sulcus. This is the floor of intertubercular sulcus. Nutrient foramen seen at the medial border. Then there is a posterior surface which lies between this medial and lateral border. Its upper end is marked by oblique ridge. So we have studied about three borders, anterior, medial and lateral border, and three surfaces, anteromedial, anterolateral and posterior. Now let's discuss about the lower end. The lower end has the condyles. These are the condyles which are expanded from side to side and has articular and non-articular part. First, the articular part. Articular part includes capitulum and trochlea. This is capitulum, which is lower end and rounded, and here is trochlea, which is pulley shaped. This capitulum uh, is a rounded projection and which articulate with the head of radius. As we know, radius is the lateral bone, so this is lateral side, lateral end, and this is the capitulum. And here is the trochlea. It is pulley shaped surface, so it articulate with the trochlear notch of ulna medially. Then let's see the non-articular surface. Above these condyles, there are the epicondyle. Here is the medial epicondyle and here is the lateral epicondyle. The medial epicondyle, it is a prominent bony projection on medial side of lower end, which is subcutaneous. And lateral epicondyle, this is smaller than medial epicondyle. Then there is a sharp lateral margin just above the lower end. Here is a sharp margin laterally, which is known as lateral supracondylar ridge. And here is medially medial supracondylar ridge. Okay, and there are the fossas. Like here is the depression just above the anterior aspect of trochlea known as coronoid fossa, and it accommodates the coronoid process of ulna, hence known as coronoid fossa. And there is the radial fossa. Again, there is one depression present just above the anterior aspect of capitulum. So here is coronal fossa, and there will be the radial fossa. On the posterior aspect, there is the just above trochlea, there is the olecranon fossa. So we have seen about the lower end, articular part, capitulum, trochlea, coronoid fossa, radial fossa, olecranon fossa. Then this is medial epicondyle, lateral epicondyle, lateral supracondylar ridge, medial supracondylar ridge. Then the joints related to humerus bone are shoulder joint, radiohumeral joint, and ulnohumeral joint. And one another joint are radioulnar joint. Then side determination. You should identify whether the humerus is right or left sided, its upper and lower end, anterior and posterior view. This is the upper end, which is rounded to form the head. The lower end is expanded from side to side and flattened from above before backward. The head is directed medially, upward and backward. There is greater tubercle and lesser tubercle. Then here is the bicipital groove. This is the lateral lip of bicipital groove, and here is the medial lip of bicipital groove. Then this is medial border, lateral border, and on the anterior aspect there is the anterior border. Here is the anterolateral surface, anteromedial surface, and this is the posterior surface. Here is the lateral supracondylar ridge, which is sharp at lower end, and on medial side there is medial supracondylar ridge. Okay, so now you should determine which sided bone it is, right or left, which bone it is, its upper, lower end, anterior, posterior surface, and all its features. Now, muscle attachment of humerus. First, subscapularis. This is the multipinnate muscle which is inserted into the lesser tubercle of the humerus. Then there are three muscle insertion over the greater tubercle: supraspinatus, infraspinatus, and teres minor. How one should remember it? By the mnemonic SIT, sit. Okay. So on greater tubercle there is insertion of sit muscle, that is supraspinatus, infraspinatus, and teres minor. But don't get confused with the teres major. Remember, on greater tubercle it is minor. Okay, so supraspinatus is inserted into the upper impression of greater tubercle, infraspinatus on the middle impression, and teres minor on the lower impression. Then we will see about the intertubercular sulcus. Lateral lip of intertubercular sulcus has insertion of pectoralis major, latissimus dorsi on the floor of intertubercular sulcus, and teres major on the medial lip of intertubercular sulcus. So, bicipital groove or intertubercular sulcus has three muscle insertion that are PLT. Remember, it is from lateral to medial. PLT, pectoralis major, latissimus dorsi, and teres major. On greater tubercle, there is teres minor, and on intertubercular sulcus, there is teres major. Now, one more insertion is there, which is of deltoid, which is inserted into the deltoid tuberosity, and coracobrachialis, which is insertion into the rough area of middle of medial border. So these were the insertion. Then let's talk about the origin. First, brachialis, which arises from lower half of anteromedial and anterolateral surface of the shaft. Brachialis. Then brachioradialis. It arises from upper end two-thirds of lateral supracondylar ridge, and here is the extensor carpi radialis longus, which arises from lower one-third of lateral supracondylar ridge. Then pronator teres. It is on the medial supracondylar ridge, lower one-third side. Then the lateral head. Here is the lateral head of tricep brachii. On posterior surface it is. There is radial groove. Just above radial groove on oblique ridge, there is origin from of the lateral head of tricep brachii muscle. And the last is anconeus. It arises from the posterior surface of lateral epicondyle. Now, three nerves are directly related to the humerus, therefore liable to injury. The axillary nerve, here is the axillary nerve at cervical neck, the radial nerve at the radial groove, and ulnar behind the medial epicondyle. As we saw previously, there are three anatomical neck with separate head from upper end, then surgical neck with separate upper end from shaft, and morphological neck. Now let's see ossification of humerus. Humerus ossifies from one primary and second secondary center of ossification. The primary center appear during 8th week of development. The secondary center upper end ossifies from three secondary center. Here are three. One for head at the first year, one for greater tubercle for the second year, and one for lesser tubercle at the fifth year. These three center fuses during the sixth year to form one epiphysis, and these three fuses with the shaft during the 20th year. Now the lower end. It ossifies from the fourth center which forms two epiphyses, one from capitulum and lateral flange of trochlea at the first year, one of the medial flange of trochlea, here it is at the ninth year, and one for the lateral epicondyle, here it is at the 12th year, and three center fusion at 14th year to form one epiphysis, and it fuses with the shaft during 16th year. So upper end at the upper end secondary center, they fuses with the shaft during 20th year, and at the lower end they fuses with the shaft during the 16 years. After learning humerus anatomy feature its muscle attachment, it is important to study clinical anatomy about the humerus. So common site of fracture of humerus are surgical neck, shaft, and the lateral supracondylar region. Supracondylar fracture is common in young age, produced by fall on outstretched hand. The lower end is mostly displaced backward side. This fracture may cause injury to median nerve. It may also lead to Walkman ischemic contraction. Why so? Because of the occlusion of brachial artery. The humerus has poor blood supply at the junction of its upper end and middle third. So the fracture at the site showed the delayed union or non-union. The head of humerus commonly dislocate inferiorly. So this was the video about the humerus. Its all features, side determination, muscle attachment, its joint related joints, clinical anatomy. Hope you found this video insightful. Thanks for watching. Keep learning, keep growing. Thank you.